Does a physical exam count as a diagnostic procedure for bladder issues? When it comes to bladder issues, many people wonder if a physical exam can serve as a diagnostic procedure. A physical exam is often the first step in assessing any health concern, including bladder problems. However, it is primarily an initial clinical assessment rather than a definitive diagnostic tool. During a physical exam for bladder issues, a healthcare provider typically checks the abdomen and pelvic area for tenderness, masses, or other abnormalities. In men, this may include a digital rectal exam, while women may undergo a pelvic exam to evaluate adjacent organs. Despite its importance, a physical exam has limited sensitivity and specificity for detecting bladder conditions. Many bladder issues do not present obvious physical signs, making it difficult to draw conclusions based solely on this assessment. To accurately diagnose bladder issues, especially more serious conditions like bladder cancer, healthcare professionals relying on additional diagnostic procedures. One common test is urinalysis, which analyzes urine for blood, infection, or abnormal cells that may indicate cancer. Urine cytology is another laboratory test that can provide insights into bladder health. Cystoscopy is a key diagnostic tool that allows doctors to visualize the bladder lining directly. In this procedure, a thin scope is inserted through the urethra, enabling the healthcare provider to look for abnormalities and take biopsies if necessary. Imaging studies, such as ultrasound, computed tomography scans, or magnetic resonance imaging, can also help by providing detailed views of the bladder and surrounding structures, helping to identify tumors or other issues. In some cases, a biopsy may be performed to collect tissue samples during cystoscopy or surgery. This is crucial for confirming the diagnosis histologically. While a physical exam is a valuable first step in evaluating symptoms like pain, blood in urine, or urinary difficulties, it does not replace more specific diagnostic tests. For instance, when bladder cancer is suspected, cystoscopy combined with biopsy is considered the gold standard for diagnosis. Imaging studies are essential for staging the disease. In summary, while a physical exam plays an important role in the clinical evaluation of bladder issues, it does not count as a standalone diagnostic procedure. A definitive diagnosis requires a combination of laboratory tests, endoscopic evaluations, and imaging studies tailored to the individual's symptoms and risk factors. Anyone experiencing urinary symptoms or signs suggestive of bladder disease should seek professional medical evaluation that includes these comprehensive diagnostic procedures for accurate diagnosis and appropriate treatment.